Hi guys, it's Arya here. For the project, I decided to choose the Health Intervention Redesign option, and yeah, let's just jump right into it. So the health-related issue that I decided to focus on for this project relates to mental health and the disorders and illnesses that come along with it. And I chose this because it's kind of something I feel strongly about, and not to mention I feel like it's something that's definitely going to be hit the hardest considering what's going on in the world right now. So the scope of the issue kind of relates to the fact of that dealing with a mental illness definitely affects the way you think, the way you feel, how you act, and your mood. And it also affects your ability to relate to others and how you interact and function around other people and in life. And when you're stuck inside with a disorder in your thoughts, it's really, really tough to kind of keep track of your medications and really tough for you to kind of be motivated to get better or want to get better. And also, it really sucks to be without your friends and not being able to do things outside of your house with your friends and the activities that you like to do that keep you happy. So that's the scope of the issue that I decided to focus on. So, the population that is impacted by this health issue are those that are primarily struggling with mental health at any level, whether it be anxiety or mood related, um, eating or food related disorders or psychotic disorders, or it can just simply be people dealing with like sleeping problems, relationship issues. Um, but regardless, these types of people that are dealing with these things are really going to be impacted the most, especially if you're stuck in the house. Like I said before, if you have like anxiety or depression, you already have to deal with these thoughts of your own on daily basis. And so when you're stuck and confined in a place where you can't really do much, it's going to really take a toll on your mental. As for eating and food disorders, like being stuck in the house with nothing but like not much to do, but your homework or watching TV and eating, that's really going to take a toll on the way you feel about yourself and the way your disorder is impacting you. And as you all know, we are in the middle of a pandemic. We are dealing with COVID-19, and it's definitely impacting so many of us around the world. It's a time of panic and a time of loss for a lot of us, and times are a bit more stressful for everyone, especially dealing with social distancing and quarantine. We can't really do the activities that we like to do or be with people that really help us feel better and the people that we love, and it's a lot tougher on us, and it's definitely a lot less convenient for people to get their treatments or their medicines or their sessions in the way that they should. And so that is definitely something that needs to be worked on with intervention. And overall, we need to help improve the symptoms and betterment of the patient. But now is definitely a time where they need it more than ever. The targeted intervention that I decided to talk about is cognitive behavioral therapy, also known as CBT, which is basically a short term, goal oriented psychotherapy treatment that tends to use hands on, practical approaches to problem solve. It definitely focuses on the understanding of the patient's thought process and what they're going through. And it really works on changing people's cognitive processes, which will ultimately, in the end, or hopefully in the end, impact their behavior and emotions in a healthier way. And if you can read the picture, it definitely talks about how it allows for patients to learn how to automatically identify their negative thoughts and positive thoughts. Not every therapy that a patient goes through has to talk about their negative situations. It's something that is just individualized for them depending on what they're going through. Okay, so going into more detail about cognitive behavioral therapy, some of the goals that are related to this intervention are centered around the changing of the patterns of the way a patient thinks and behaves, and overall just kind of helping them with the way that they feel about their issues and the way that they're processing their emotions and how they are going about things. And it also relates to the bettering of their issues, whether they be a wide range or not, in a patient's life, and they don't necessarily have to be related to their disorder or a disorder. Not everyone who has cognitive behavioral therapy has a disorder or mental illness. They can be going for sleeping difficulties, relationship problems, emotional related issues, anything that they feel they need to be talking to a professional about. Um, So there's that. As far as how long the treatment takes, that depends on the patient and the therapist as well, and what kind of things you're going there for. So CBT is very individualized and very customizable depending on what you're there for, what you're talking about, what kind of therapist and what kind of specialized doctor you're working with. So you definitely need to keep that in mind. But typically the time range for how long a treatment takes is around 5 to 10 months generally, but and that's mostly for emotional related issues, but generally 5 to 10 months is kind of the normal range of how long treatment can take. And each session lasts for about 50 minutes to an hour, and each patient would go once a week and go through those sessions for about that much time. But once again, it also depends. This is just a general time. And as far as what the sessions are like and how they're carried out, once again, it depends. But normally it's a patient and therapist type of deal. These kind of therapies like cognitive behavioral therapy or psychotherapy or behavioral therapy that are, carried out like this, it really focuses a lot on the relationship between the therapist and the patient. It just kind of helps them with a better connection and a stronger connection. And so the way that that would start off, they would discuss their specific problems and goals that they would like to focus on. And those goals can be anything, once again, depending on what you're trying to work on. As far as if you have an eating disorder, one of the goals might be to focus on, getting more nutrition or focusing on how to make a meal plan, something like that. And that would become the basis of each session and the way that they go about it each time. And sometimes homework will be given at each session, and they will discuss the progress made with each assignment at each different meeting. And so an example of a homework assignment would be keeping a diary to track your emotions or what you've eaten in a day, kind of like a self-monitoring type of situation. And each time they come back to a session, they would talk through the progression of what they wrote down or what they talked about and what they felt throughout that time, and they would then go from there. So there are also pros and cons to this type of intervention. And so the positives would be that it's compatible with other interventions, like physical therapy or pharmacotherapy. It promotes self-management, meaning that it really takes its focus on self-monitoring, really allowing for their patients to kind of focus on learning how to do things on their own instead of depending on a therapist or other people to kind of function in daily life. There's also strong empirical support in research, meaning that there's a lot of evidence that kind of supports CBT and the fact that it does work, and it is looked at as one of the main primary interventions and treatments for people dealing with disorders or any other type of issues going on in their life. And it is individualized, like I've been saying. It's a customizable intervention because a therapist can kind of work off of what the patient is going through to make a polished treatment for them. Some of the cons would be that it's not suitable for all patients. If you are someone who has moderate to severe cognitive impairments, it's probably not going to be one of the best treatments for you. You're probably going to need something a lot stronger and a lot more reliable to work for you. And it requires sustainability and active participation. A lot of the things that go on with this intervention are hands-on, and it's really effective when you get to do things like this in person with a therapist, with someone that you are comfortable with. It's not available to just anyone by anyone, and what I mean by this is that it's not going to be available everywhere to you, depending on who is licensed and who is qualified to do this job. You can't just get it from any kind of doctor. They have to be specialized in their training to do something like this with the patient. And it focuses a lot on behavior versus the whole patient. This is something that's going to focus on the way you act and the way you feel your emotions versus your life and the way that you are as a whole person. It definitely takes its time on looking at certain aspects of a patient instead of the whole person. And cost varies. This can be a positive or a negative because it also depends on what you're there for, how long your sessions take, what kind of therapist you're working with, and so it can be pricey or it can be affordable depending on what you are going there for. So finally, this leads me to my novel approach to the situation. I would like to produce this intervention virtually, whether that be by Zoom, FaceTime, Skype, Facebook Live, any way that this can be done with as much minimal contact as possible, considering that we are in a pandemic and we have rules to follow. which is one of the reasons why I chose this, is because we follow the rules related to the current events, meaning we do have to follow quarantine and social distancing rules, and so this is the easiest way to keep not only the patient healthy and safe, but the therapist safe as well. And I say change times if necessary, and by that I mean every patient and therapist has certain times and dates that they have set for their meetings and their sessions, and if they don't need to change, then they can stay the same, and if they do, then they can change them accordingly. It's efficient. Over FaceTime or over Zoom, it's an easy click and you can just jump right into your meeting, into your session. And accessibility, I say it can vary because I know not everyone has access to the internet or to social media apps, and that's something I need to take consideration, but I was generally thinking of the, general population, how almost everyone has some type of internet or device, whether that be their parent or their siblings. So I believe that it's something that can be easily fixed, and if not, that is something that can be talked about financially with their therapist and with their family. Um, and also, I know a lot of patients' families like to be involved with their therapies, and so this is also an easy way for them to stay involved because everyone can fit into a camera and talk to the therapist. It's something that's very easy and well executed if done correctly. So I believe that that is just one of the ways that I would like to present this intervention, and I think that is all that I have. So thank you.